Karen, very good afternoon, and thank you for speaking to us. So there have been multiple conversations around COVID, then again about the variants that we're experiencing. Now there's something called long COVID. Please take us through what this is.
So long COVID is when COVID just won't go away. So it's about 10% of people who have COVID will still have symptoms about 3 weeks after they've had COVID. And about 1% of people who've had COVID will still have symptoms after 3 months and longer after having COVID. So it's lingering symptoms after an attack of COVID.
So essentially, you have COVID, you have tightness of the chest if it is, or difficulty in breathing, you then recover, but still those symptoms stay with you.
Oh, so the symptoms that stay might not be exactly what you had when you had the COVID. Some people who developed long COVID had a very mild COVID, just a mild flu-like illness, and others would have been much more severe with shortness of breath and really a man down with needing oxygen. But it doesn't seem to matter whether you had a very severe COVID or mild COVID. Both seem to be equally at risk of developing symptoms of long COVID. And the types of symptoms, the very common one is fatigue, which means just feeling tired all the time. There are other neurological symptoms. People describe brain fog. They just can't think straight. They can't concentrate. Their memory suffers. Spells of dizziness, can't smell and taste. That can sometimes also linger. Then you get pain symptoms. So you get your headaches, myalgias, chest pain at times as well. Lingering respiratory symptoms, or they can even come in waves of sore throat, shortness of breath, cough. In fact, there are so many symptoms that have been described. I can't actually list them all right now, but a very, very wide range of symptoms have been described.
So ordinarily when you recover from COVID, does this mean that the virus has completely left your body? And then obviously if you have long COVID, is this the presence still of that virus?
So obviously there's still research ongoing, but currently the most accepted theory is that the COVID is no longer present, but that there's immune activation in the body that's just ongoing. It doesn't want to sort of switch off. So your own immune system continues to kind of fight against this virus, whether there's still fragments of virus or whether the virus is completely gone, we're not quite sure. But a lot of the symptoms seem to be this chronic immune activation.
So is there any way of mitigating this? And are some people more prone to long COVID than others?
So we wish we knew how we could mitigate this. That's something we need to research because it is a very debilitating condition. And it does seem to attack the old and the young, the healthy, the fit, as well as the more seriously ill patients. And so there are a few studies that show maybe women are slightly more predisposed, maybe folk who've had more mental illnesses are more predisposed. But again, the jury's a bit out still as to whether that's true, but it definitely doesn't seem to matter how severe COVID was. And I've got many patients who had no comorbidities, who were completely fit and healthy, who got long COVID.
What about the issue of BMI? There has been some suggestion that BMI plays a factor.
Yeah, so that's another one of the issues where BMI does seem to maybe play a factor, the higher BMIs. But again, I've had patients who've had perfectly normal BMIs who've got long COVID.
Now, there are also suggestions, Karen, that health workers are pretty vulnerable to long COVID. Is this correct? If so, why?
I'm not sure if they're more vulnerable than the rest of the population, but they certainly do get long COVID. And I certainly do know of many healthcare workers who've had long COVID, and it's very hard on their practices.
Now, I think, I'm not sure if this information is correct, but I understand that you did suffer from COVID at some point. Is this correct?
I did. Look, I can't really say that I had long COVID, but I was tired for 10 weeks. I had severe fatigue for 10 weeks, but after 10 weeks, I recovered fully. And so by strict definition, that seems to be the one that they're using at the moment is 3 months. If your COVID symptoms continue for more than 3 months, then it's classified as long COVID. And if it's less than that, it's subacute COVID. So it's somewhere in between normal COVID and long COVID. But yeah, fortunately I've recovered, but I've got friends, I've got many patients and other colleagues who are still battling with long COVID, and it's a very, very difficult condition for them.
Maybe briefly, just take us through how you dealt with COVID and obviously that post-recovery. Are there any things that you're doing differently? Because I think, like you mentioned, the jury's still out on whether you can catch COVID a second time.
Yeah, so with COVID, well, myself, I'm not quite sure what you're asking. In terms of the fatigue, I had to take it very easy. And I think that's one of the take-home messages for folk that are suffering from long COVID, is that you should take it easy. You should actually listen to your body, and you should rest as much as your body needs to rest. They actually think that long COVID is similar to the chronic fatigue experienced after other viruses, even after SARS, COVID-1, so the other form of COVID, coronavirus. You do get people who get a long form and a fatigue after that. And some of the studies suggest that if you actually rest and that you take it very easy and you don't overdo it, your chances of getting over it quicker are increased. And that's certainly the same with chronic fatigue studies and myalgic encephalopathy type studies. So my recommendation is, if you've got COVID and you're feeling tired, rather rest. And then the second part of that question, and I'm not quite sure what you were asking, but in terms of catching COVID again, you certainly can catch COVID again, especially with all the variants out there, unfortunately. I think you do have a decreased chance of catching COVID again. So you will have a certain amount of immunity, but it's not impossible. So you still have to take all the precautions.
Absolutely agree. Final question, though, might even be just an opinion. We've noticed from athletes and obviously other professionals in that sort of area that very few of them are catching COVID, and those that do catch it recover without any challenges. Your advice for those of us that are couch potatoes and obviously not exercising as much as we could?
Well, I think it's the benefits of exercise are so good in terms of COVID, in terms of all the other chronic diseases. So obviously exercise is crucial. The reason I laughed is that one of the GPs in our group is specifically into sports medicine, and he's actually looking after a number of athletes who've got long COVID. So it doesn't completely miss long athletes either. But I think COVID is going to be less likely to catch you if you're young and fit, if you're fit and healthy, exercising lots.
Dr. Karen van der Merwe, thank you so much for your time talking to us about long COVID and the challenges associated with that.